I'm Dr. Rastogi. I'm a psychiatrist specializing in anxiety disorders at the Northside West Clinic. Today I'm going to be talking about anxiety disorders. Anxiety can control people's life in a bad way. They can interfere with their functioning emotionally, socially, and functionally, mainly based on fear and avoidance. These are the two factors that lead to ongoing anxiety. The ways to work around that, as we talk, is mainly about through talking therapies, but also being aware, accepting, and challenging these beliefs through what we call is graded exposure therapies, where you have these thoughts saying that something bad's going to happen and you test it under with support and you have good outcomes. So this is a process which takes about 6 to 9 months or even longer and has the best outcomes for relapse prevention. The treatment of anxiety is quite varied. There are different kinds of treatment approaches for anxiety. Medications are one form of treatment. The other forms of treatment are talking therapies, which are commonly used in conjunction with medications mainly. And the third form of treatment is mindfulness and lifestyle changes, which are just as important adjunct to the treatment of anxiety. So talking about medications, there are a wide range of medications we use for managing the physical symptoms of anxiety. Talking therapies are very good at looking at behaviors and thoughts, and of course a lifestyle approach is the best way to decrease stress and response to anxiety. Cognitive behavioral therapy is a very structured talking therapy which is used for anxiety disorders and other mood disorders. It is the here and now therapy where you're actively involved with the psychotherapist talking about the current issue. So it's based on three things: behaviors, thoughts, and feelings. It is clear that our behavior is based on what we think, and that helps us to feel the way we feel. So cognitive behavioral therapy targets onto behavior modification, changing some of the behaviors. It helps with challenging thoughts. There's certain thought processes which come with anxiety, such as all or none thinking or catastrophic thinking, and that's challenged. And this in turn helps us to change how we feel, good or bad, about ourselves. The most effective treatment for anxiety is a combination of talking therapies or cognitive behavioral therapy, as well as medications, which we usually prescribe for at least 6 to 9 months or longer to prevent relapse and have better outcomes of functioning. The treatment of anxiety varies from person to person as well as the triggers associated with that. For an acute anxiety disorder, the treatment is usually for 6 to 9 months with good response and relapse prevention. However, if a person has chronic anxiety or relapses, they may need treatment for 2 or 3 years or even longer depending on their symptoms and triggers. There are different medications used for the treatment of anxiety disorders. The common classes of medications we use are antidepressants, as people are aware of. The other classes are mood stabilizers, and the third class we use are called benzodiazepines, which are used short term for the management of acute anxiety. Antidepressants, they work on different chemicals and they are the mainstay of treatment, while benzodiazepines are short-lived, used for at least 3 to 4 weeks or even less because they're associated with dependence. Antidepressants play a very important role in the treatment of anxiety, especially in the acute phase of anxiety. They help to decrease some of the physical symptoms of anxiety, such as the sleep problems, the amotivation, the concentration, the appetite, and the energy levels. However, once they start feeling better on these areas, they're then able to deal with some of their thoughts and beliefs. So they play a very important part in moderate to severe anxiety, and with panic symptoms, they do have a role to help elevate the symptoms and improve functioning. People usually have fear about starting antidepressants and coming off antidepressants. The common fear is based on being dependent on antidepressants and whether they will be able to function without antidepressants. We usually reassure them that antidepressants are used for the time of acute anxiety. Once the acute anxiety is settled and they have developed coping skills, most of the people can come off antidepressants and they do not cause any dependence and tolerance. There is a fear about coming off antidepressants and having a relapse. However, by the time the patient has completed 9 months of treatment, they are very well equipped with other tools and aware and accept their condition and have their support groups available. So anxiety is caused by a chemical imbalance in the brain. In the brain, the messages are passed through electrically excited neurons, and we need chemicals called neurotransmitters, which are used to pass the messages from one to the other. There are 3 types of main neurotransmitters which are used to pass the messages. These include noradrenaline, serotonin, and dopamine. Apparently, when people have anxiety disorders, there's an imbalance of these chemicals, which leads to the development of anxiety. And this is the basis of trialing antidepressants. The role of antidepressants or other medications is to correct the balance in these pathways and help the messages to pass more smoothly and help with better functioning. Medications do have side effects, unfortunately. There's a range of side effects people can experience from different kinds of medications. The common side effects people experience are nausea, vomiting, which are common to all medications. However, when trialing antidepressants, there are certain specific side effects such as agitation. Some people can experience worsening of their negative thoughts, and they can have some extrapyramidal side effects or body movements which can be present. They're not dangerous or life-threatening. However, if the symptoms do occur, we recommend to talk with their doctor or the psychiatrist and under supervision stop the medications. It's also important not to stop the medications on your own accord because you can have withdrawal symptoms. Generally, when medications are prescribed, it takes 6 to 12 weeks for the medication to work. The first few weeks, the symptoms observed are side effects, the first 10 days. This is generally followed by feeling of wellness in terms of sleep, appetite, concentration. By around the 12 weeks, a person generally will let us know that they're feeling better. Usually in about 9 months to 12 months is the right time to wean off medications, provided the person has invested enough in other talking therapies and lifestyle changes and has knowledge and awareness of their warning signs and has accepted the condition. The treatment of anxiety during pregnancy is very different to treatment of anxiety in normal population. During pregnancy, it is very important to treat anxiety because we look at the risk versus benefit. The risk of not treating anxiety has a poor outcome on the mother as well as the fetus and postnatally increase the risk of postnatal depression. However, treating anxiety during pregnancy has limitations, especially medications, and we prefer to use talking therapies as the first line and supportive therapies, and if needed, occasionally do use certain classes of medications, taking in mind that it can impact the fetus.